Welcome to our next edition of Facebook Live. Always a good opportunity to update people on the campaign. This week we've had some excellent events to attend. First off, on Wednesday evening, Kathleen and I attended the 10th anniversary banquet for the Wisconsin Institute for Public Policy and Service. This is an institute that was set up in Wausau, and their goal is to further civic discourse and bipartisan solution to problems. So in the spirit of that, their two guests were former Governor Tommy Thompson and former Secretary of Health and Human Services and Chancellor of the University System, Donna Shalala. So they took questions from all of us and talked about how we can work towards bipartisan solutions in a civic way. And I was particularly moved by Governor Thompson's comments. He talked about how when he first became governor, he was the Republican governor, and the legislature was all Democratic. And so typically they would pass bills, they would come to his desk, and he would veto them. So that went on for about a year. And all of a sudden, he realized that the people of Wisconsin were being hurt by this conflict. And the public need was not being addressed, solutions were not being found, problems were not being solved. And so at that point, he started inviting the Democratic leadership of the legislature into his office on a regular basis, and they would talk about what the limits were of how far they could go to find solutions together. And after that, their relationship became much more collaborative. The legislature started passing bills that he found acceptable, and of course he started signing them. So I think that spirit of how do we solve problems together, how do we look for solutions in a bipartisan way to help strengthen our communities really touched me and sort of spoke to how we, at the end of the day, we live in communities. We don't live in political parties. We also had an excellent event in a home in Wausau on Thursday evening, and I find those events particularly helpful and energizing because not only do I get a chance to tell my story, but more importantly, I get to hear what's important to the people in the 7th District. So with that, we'll take our first question.
At his Spooner Town Hall yesterday, Duffy said it is too soon to act to protect the USA from Russians tampering in our elections. Are there bipartisan bills in Congress that you would sign or endorse when elected?
I think it's never too soon to protect our electoral process, to make sure that our core value of democracy is honored and protected. And certainly there are ongoing investigations to find out how deep the Russian influence went, but we already know that the influence occurred, and I suspect this week when the head of Facebook is in front of Congress, we may learn even more about how we were unduly influenced in our views prior to the election of 2016. I think one of the key things we've learned so far is that those interfering in our election process here in the United States from Russia were not so much interested in any particular outcome of the election. They were more interested in getting us to be angry with our neighbors and to divide us, because they would actually try and incite events where people with opposite perspectives would show up at the same time and basically try to incite riots. I think there's a lot to be learned from this. I think it speaks to what's our patriotic duty, and our patriotic duty is to be very concerning when someone's trying to get us to hate our neighbor or trying to get us to be angry, because they probably don't have our interests at heart. And clearly, one of the most patriotic actions we can take is to be good neighbors, to have civil discourse in the community, and to work towards solutions and realize our goal is to have stronger neighborhoods, stronger communities, and a stronger country. Obviously, those trying to interfere in our election process from Russia didn't have those interests at heart.
In what ways would you work towards assisting Wisconsin's 7th District in moving from carbon to renewable energy sources?
That is an excellent question because it cuts to so many issues. First of all, it cuts to the importance of recognizing climate change is occurring, the science is in, we need to address climate change. And certainly we need to address climate change because of our local environment, but More importantly, we need to address climate change because it has national security concerns. It has economic concerns. When hurricanes destroy Houston and Florida and Puerto Rico, we're all impacted by that. But more specifically, closer to home, there's great economic reasons to support transitioning away from carbon here in the 7th District. When we put solar panels on our home, we help employ workers and electricians here in the 7th District. I think we need to continue to support the transition so that people can think globally but act locally in terms of moving away from carbon-based sources of energy.
Are you a member of Physicians for a National Health Program?
Now, the Physicians for a National Health Program are one of the excellent groups that are working towards finding ways to solve our healthcare cost problem. This issue is actually the one that got me into politics in the last year and a half. Last summer, as the healthcare bills were working their way through Congress, I started giving talks in the community so that people could understand the complexities of the problem and the adverse parts of the bills that were coming through. Fortunately, in regards to those bills in Congress last summer, John McCain did his rather famous thumbs down well after midnight so that those bills did not become law. Why it was so important for those congressional bills to not become law is because they would have hurt people in the 7th Congressional District. There would have been people, 60-year-olds, who currently have health care coverage who would have been priced out of insurance. So they may have had insurance technically accessible, but it would have been completely unaffordable with their premiums rising to 50% of their income. It also would have been bad for business because eventually that person who can't afford insurance ends up coming to the emergency department. They need care. We as doctors and hospitals are morally obligated and ethically driven to provide that care. But unfortunately, the only way to cover the cost of that care is to then increase the price of insurance to the business community. So that bill that was before Congress last summer would have been bad for the people, and it would have been bad for business. Now, in terms of the specific group that was in the question, what they're looking for is how do we solve this problem? Well, we know that there are some key factors that are causing healthcare in the United States to be more expensive. First one is pharmaceutical costs. We need to bring down pharmaceutical costs. One particular disease called hepatitis C, there's now good treatment for that. Turns out if you have that disease in Switzerland, you pay half as much to be cured as you would pay in the United States for exactly the same drugs. So what is Switzerland doing that we're not doing? Well, they are negotiating and competing, setting the prices on those drugs, and so that businesses and insurance and our public programs are not bankrupted by pharmaceutical costs that are far and away above what is necessary for the pharmaceutical industry to stay in business and develop new drugs. So we need to address pharmaceutical costs. We also need to address the administrative costs in medicine because we have significant overlay of administrative costs. Because what we know is that Americans don't seek medical care any more than people in other similar countries in Europe and Canada. The difference is we're paying more, and yet for the same service that people pay for in other countries. In terms of the core issue in this is how do we pay for this? Well, already over half of the expenditures for healthcare are paid for through tax revenue. And then the other part is paid for through premiums. And so the discussion now going back over 10 to 15 years is do we move towards what would be called a single payer program, which would be a public program, or do we continue to use insurance? And this was discussed in 2008 when the Affordable Care Act was passed. And unfortunately, the final decision was to not have a single payer option. And the solution to that was to have what was called the individual mandate, which has been challenging in terms of how we've thought about it and discussed it. Well, Congress has now acted, and it's been put into law that the individual mandate's no longer being enforced. So we tried that solution over the last 8 years, and now we've set that aside, which means the only other solution to making sure that we control healthcare costs and that everyone has healthcare coverage is to move towards the single payer option. It's going to be complicated. It's not going to be a quick fix because healthcare is about 1/5 of the United States economy. Whatever we do, we have to do it in a way that continues to protect people so that they have healthcare when they need it, it's universal, and it's affordable.
Could you expand on your statement? Without broadband access, the people of the 7th District are cut off from the larger economy. Everyone needs access in northern Wisconsin. Please explain why you feel everyone needs access, and is it threatened?
In terms of broadband being available to everyone, there are good reasons to do that. At this point, the problem is it's just not available. By the time you drive north out of Marshfield, there are pockets of good internet coverage between here and Lake Superior, but there are vast regions of the 7th District where people do not have access to broadband. It has become a necessity of modern life. The reason it's now necessary is this is how children are educated. When there's a research paper to be done, it's not the good old days of when you went and pulled the encyclopedia off the shelf at home or in the library. Nowadays, the research is done online. So children need this in order to get educated in a way that they'll be able to compete in the 21st century job market. But businesses also need this because we now have a global economy which is more and more connected through broadband and internet access. So in order to be able to market products and set up businesses in the towns of the 7th District, the businesses need to have good access. I was actually in a computer store in one of the towns north of Marshfield within the last week, and the owner pointed to a big stack of computers sitting on a cart, and she said, yeah, those are all the computers where people tried to update their operating system to Windows 10, but their access was so slow it just froze up their computer, so they had to bring them into the shop to get them fixed. So people can't even upgrade to the most secure and modern operating systems on their computers because they don't have broadband. Another reason for broadband links back to our healthcare discussion. What we know is that one of the key ways to decrease the cost of healthcare is to do everything possible to keep people healthy outside of hospitals. I mean, as a doctor, and as I'm sure any of you who have been in a hospital know, once you hit the emergency department, and particularly once you're in the hospital, we are into spending tens of thousands of dollars very quickly. So the more we can keep people healthy and keep them in their homes, one is it decreases cost, the other is it substantially increases quality of life. So what does broadband have to do with this? Well, now through telemedicine links, we can get a tremendous amount of information on how a patient is doing in their home with various monitoring devices. We then have teams of nurses who work with the patient and the patient's family so that we can make interventions before the patient becomes so critically ill that they need to go to the emergency department and be hospitalized. So broadband is crucial for education, it's crucial for our businesses, it's crucial for our health.
The people of Wisconsin feel like they're being left behind. What can we do to change that?
You know, that general sense that there are elites in the cities and elites on the coast who merely see us as flyover country is a valid sentiment. And, you know, for those of us who live here, they don't recognize that we truly do consider this the heartland, that our lives are thriving, we find ways to excel, but we do feel like when it comes time to have our share of the public space, we are sometimes forgotten. I think the broadband discussion is a crucial one. Whenever people talk about, well, we're going to cover 90% of the country in broadband, well, guess what 10% gets left out? And whether it's school programs, infrastructure programs, broadband, we end up being cut out of the public resource that's required to help our economies thrive, our businesses develop, and our children to be educated.
How can we strengthen our economy?
You know, strengthening the rural economy comes down to making sure that government does what government is intended to do for the economy, which is to provide the underlying infrastructure. And at its most basic, it is the roads, the bridges, and again, the broadband, but particularly the roads and bridges. We have forest products in the 7th District. They require heavy trucks, and they require rail infrastructure. If the roads are not in repair and the bridges are not sound, we can't move the products. The other role that government has played in the past is to provide startup money for small businesses. Small businesses create the most jobs, and they allow people to pursue their dreams. And so there are several ways to make sure that the rural development funds are there for people to start their businesses, and to make sure that people can get up and going with their startups. The other part of that is the healthcare issue. One of the biggest detriments to starting up your own business has been, how do you cover your healthcare? The Affordable Care Act made strides towards answering that, because in the past, the major form of insurance of healthcare coverage outside of the government programs was in large group coverage. You go to work for a company that employs 500 people. The problem was, if you went to a small company, you couldn't buy insurance. So this is, again, where we need to continue to work towards affordable, universal healthcare for all, because it's good for businesses.
What are you going to do to help patients with chronic pain that have had their medications discontinued?
You know, in my career as a physician, I've now lived through this story of chronic pain. And clearly, this is challenging. We have patients who are suffering. I think we now know that as the medical profession, we received inaccurate information over the last 20 years, which led us to too quickly try and solve chronic pain problems with opioids. And this, of course, led to significant harm in the communities. And so all of a sudden you had parties with adolescents where people were bringing narcotic opioid pills, and the children and the young adults were taking them, and it ended up in overdose deaths. So we now have many systems put in place so that we as physicians prescribe responsibly, and we also have ways in place that patients who are also responding responsibly can continue to receive their treatments. But clearly, chronic pain is an area that we need to continue to work on. We need to have a focus on this at a level of the National Institutes of Health, because there are many ways to address chronic pain. Opioids may be part of that overall treatment plan, but it's necessary to work on all the ways in which we can help people function well in society and hopefully maintain employment and help maintain engagement with their families. Clearly, as part of the healthcare work, we also need to continue to focus on strengthening primary care, because primary care providers need to have the resources in order so that they too can participate in the treatment plan with these patients, which is at times complicated and more time consuming, but necessary to keep people actively engaged in their community.
How can we strengthen education?
You know, education is one of the key things, is to make sure that children arrive in grade school prepared. And so making sure that Head Start and other preschool programs remain robustly funded, because it's one of the major ways. It's those crucial first few years, so that when children arrive in kindergarten, they know what a book is. They're starting to know their letters. They're ready to start learning, and they've already been taught how to learn before they get there. So continuing with Head Start. Making sure the nutrition programs continue to be funded. Hungry children do not learn well. We need to make sure that malnutrition and hunger do not hurt our children. And then we need to make sure that we have avenues available so that in education after high school, that there aren't financial barriers to people getting the education that they desire so that they can pursue their dreams. And whether that be in technical schools, 2-year schools, 4-year schools, or beyond. And that's where the whole financing piece comes up, because we do need to strengthen that part of it through the student loan problem. Right now, the United States government is backing $1.3 trillion in student loans. We need to find ways to unburden our young adults from that $1.3 trillion so that they can successfully launch into their adulthood.
What is your position on the privatization of the air traffic control system?
There are just certain parts of our society that need to remain in the public sector. And clearly, the things like the Department of Defense, the military, is one of the areas that stays in the public sector. And I would maintain that air traffic control is very similar. We clearly need the best and the brightest. When we think about the absolute marvels of the 20th century, air transportation is one of them. That we have these incredibly complex machines designed by thousands of engineers that can transport us, but more importantly, that every day they safely land and take off. And I personally am always amazed when that happens in dense fog and think about all the people involved in keeping us safe. That belongs in the public sector. Clearly, this is not an area where we're going to set up competing companies outside O'Hare Airport to compete for which plane is going to land on which runway. So there are certain areas, the military, air traffic control, and I would add to that prisons. There's no room for people seeking a profit motive to run prisons, and it ends up with this really perverse notion that all of a sudden people are advocating for more prisons because they're looking to increase their profit motive. So there are just certain parts of our society that we clearly need to keep in the public sector, and I would say that air traffic is one of them. It looks like we have time for one more question.
Our country's politics seem to be so toxic right now. Why do you want to be in Congress?
I do want to be in Congress to help further conversations. As a physician for 25 years, I have worked to serving the needs of my patients through collaborative team efforts. We don't always agree. Every day when we take care of complicated patients, we'll have different perspectives on exactly what's the right course. So we work through it together. We have that discussion. Also, when I was president, a healthcare executive and chairman of the board of a healthcare entity, I presided over a team of rivals. I'm accustomed to having a group full of people with very energized and strong opinions that don't necessarily align, and how we work together to remember our core mission, which in that case was to serve patients. In the case of Congress, is to serve our constituents, our communities, and our country. So I have leadership experience in working towards solutions with other very energized, opinionated people, so that at the end of the day, we probably none of us get to walk out of the room thinking we got everything we wanted, but we all walk out of the room knowing that we have furthered the mission of why we came there in the first place, to make our community stronger and to make our country stronger. Thanks again for joining us. We certainly look forward to doing more of these in the future, and we'll be posting them on the page, and so that you can keep sending those questions in. Take care.